So what I'm going to demonstrate is three different tests for subscapularis or infraspinatus or supraspinatus tears. So for the first one, I'm going to demonstrate the external rotation lag sign, and this is a high specificity test for supra or infraspinatus tendon tear. So you want your patient in sitting with the elbow into 90 degrees and their shoulder into 20 degrees elevated into the scaption plane, just like so. So the first part, you want to ask the patient to try to maintain this position, have one arm supported underneath just in case they drop. So the first part is if they cannot maintain this external rotation position, just like so, and this drops, that indicates an infraspinatus tear. And so for the second part is if they're not externally rotated and that arm drops inward or it adducts, that would indicate a supraspinatus tear. And so a positive sign would indicate that, or that drop occurs more than 5 degrees. And then we'll move on to the drop sign test. And it's going to be the same as earlier, but you want your patient into 90-90, just like so. And then you're going to ask the patient to try to maintain this. Make sure to stabilize underneath the elbow joint. And if this does drop, it is an indicative of infraspinatus tear. And then from there, we're going to move on to the internal rotation lag sign. And it's also the same thing as earlier. You're going to have your patient with the arms behind the back, 20 degrees of extension and 20 degrees of elevation and into maximal internal rotation. So instead of having the patient move their arm away from the body, you're going to have them rotate it outwards, just like so. And that, so a slight lag of this is going to indicate a partial tear of the subscap, or a full tear is going to indicate a full subscapularis tear.